coming. I want to thank the Strong Fertility Center, although I don't think anyone's representing them here at the moment, but I think they will maybe be popping in for having me. My name is Ethan Borg. I'm a licensed acupuncturist. Hello.
Seats over there.
I know a lot of people here are new to acupuncture, so part of what I'm going to talk about today is how an acupuncturist becomes an acupuncturist and how someone like me becomes a specialist in fertility. I'm going to talk about our assessment tools, our techniques just a little bit, and then get into more of the nitty-gritty of fertility and acupuncture and what you can do to improve your odds and how you can use acupuncture, how you can maximize the effects of the acupuncture in addition to having the benefit of acupuncture with IVF. So I have I'm a licensed acupuncturist. That just means I'm licensed by the state. The credentials are crazy with acupuncture. You might see something like a M.A.C, L.AC, M.A.OM, D.O.M, although it's not likely to see D.O.M in this area. What these mean, a master's in acupuncture is M.A.OM. That's basically the terminal degree right now in acupuncture. That's what most people have. I'm sorry, an M.A.C. M.A.OM is a Master's of Acupuncture and Oriental Medicine. That means that in addition to going through a 3-year program like a Master's of Acupuncture, the recipient has also learned Chinese herbal medicine, and which is thousands more hours of schooling. And that's my degree is an M.A.OM. And then there is the D.O.M, which is a Doctor of Oriental Medicine. Now, D.O.M is offered by certain states. Just if you already have a master's degree, you're automatically considered a doctor. That's not true in this state. The state, you could not call me a doctor. But there are programs on the West Coast where you can get a doctorate in Chinese medicine, mostly for research. Very few people, maybe a handful of people, have actually received it. That's how new these degrees are. So you are not likely to come across that, but most people you'll see are going to have M.A.C by their name and L.AC. You may also see something called Diplomat of Acupuncture or Diplomat of Oriental Medicine or Diplomat of Herbal Medicine. This just means that the person has passed the national boards. So I have a Diplomat in Oriental Medicine, which means I passed the boards in Acupuncture and Chinese Herbal Medicine. So the education is a 3-year program, is the base program. Before you start that, you go through pre-med classes similar to medical school. Physics, chemistry, biochem, biology, anatomy, and physiology. Once you start the program, then you start to get indoctrinated in a totally different way of thinking about the world, which is the Chinese medical way. I'm going to discuss the theory, and the theory is can be a little challenging from people from a Western perspective because it's so outside the box. But basically, Chinese medicine is energy medicine. In fact, I would say that Chinese medicine is really traditional physics and applying that to the body and how traditional physics describes the cause of disease and how to bring it back to balance. As part of the program in acupuncture, you get rotations. And so for me, I started off with women's health right away. My first rotation was at a women's center within a hospital, and I had multiple hospital rotations. And I was doing fertility and inducing and doing herbal medicine for fertility from the very beginning, and I've been in this field for over a decade. So as part of these rotations, you get to experience a lot of different populations and get to work with a lot of different cases. You also get to practice different styles of acupuncture. So I was talking earlier about every country that acupuncture has gone into, the methodologies have changed, so that Chinese acupuncture is different than Korean acupuncture, which is different than Vietnamese acupuncture, which is different than Japanese acupuncture. They all have the same base theory, but the actual techniques are employed differently. So I'm trained in Chinese, Japanese, and Korean. I won a fellowship in the field, and I've studied the classics of Chinese medicine, so I actually practice classical medicine. In classical, you'll hear something called traditional Chinese medicine, and that is actually something that was developed in the 1950s. So traditional doesn't really mean very old. Classical is thousands of years old. So what I practice is a methodology that has been practiced every day in a landmass greater than the United States, day after day, for thousands of years. So a lot of people ask me, you know, people say to me things like, oh, I really believe in acupuncture, and to me, it doesn't really matter to me whether you believe in it or not. It's been used and honed for thousands of years. Your belief system, I treat babies, I treat animals. It doesn't really matter to me, people's belief systems. What matters is that we can figure out what's imbalanced and bring it back to balance. That's the most important thing to me. So the approach to Chinese medicine is, like I said, traditional physics, which is to say that everything's made up of energy, including our bodies. You probably heard of yin and yang. Yang is, these are the basic polarity of how energy can flow. Either it can be bright, functional, hot, that's called yang, which we mispronounce here as yang, so yin and yang is, or it can be cold, create substance, be quiescent, we call that yin. So these are two ends of a polarity, cold to hot. And in between, there are 5 steps. There's cold, cool, neutral, warm, and hot. And each of these steps, energy is always energy, but when it's on a different step, it behaves a little bit differently. And we call these steps the 5 elements. So you might hear me say something like, you have too much water excess, or you have too much metal excess. These are metaphorical names. I don't actually mean that you have heavy metal exposure or you're drinking too much water. This is how energy flows when it's in along these steps. So those 5 steps are water, wood, fire, earth, metal. And they all have relationships to each other. One creates another, creates another, creates another in a big circle. And one controls another, controls another, controls another. So that there are all these checks and balances in the system. And what I do as a acupuncturist is to try to figure out where you have imbalances. And we have a whole methodology of feeling pulses, looking at your tongue, palpating your abdomen or different parts of your body. All this is to figure out what organs or what energetic pathways and what tissues you might have imbalances in, and what kind of imbalances they are. And with that knowledge, I can bring you back to balance. I can figure out what kind of intervention we need based on this whole interconnected system of these elements. And once you get back to balance, the symptoms go away. It's remarkable. I mean, I have people who are just flabbergasted that they could have pain for 10 years and after a single treatment have significant relief. Or for fertility, have amenorrhea for years and years and then suddenly have regular cycles just by putting needles in certain places. But it works. So everybody knows about acupuncture needles. It's the first thing you think about when we talk about acupuncture. I'm going to just send these around. Hello?
Hi there, sorry I'm late.
That's all right. I'm curious.
Yes. Excuse me.
Sure. Acupuncture needles are nothing like syringes. Syringes have to have holes in them so that you have fluid transmission. And as a result, they're going to cause wounds, and that's why it always hurts to get a shot. Acupuncture needles are much more like mosquito bites, especially Japanese style of needles, which that is. They're extremely sharp at the tip, which means that when you insert it, you either, at most you'll feel a pinch, but most likely you feel nothing at all. And I brought my needles here to actually demonstrate that to whomever is interested later on, because most people are terrified of the needles, and they really will not believe anything I say until they actually experience it. So people come to me always with their first visit with a lot of anxiety about the needles, but really the needles are nothing at all. I mean, you're not afraid of going outside because you're going to get bitten by a mosquito. And it's the same thing. Other tools we use, something called moxa. It's an herb that, I don't know if you've all seen acupuncture on TV.